Hi, I'm Dr. Jeffrey Bryant. I'm one of the residents here in the Department of Urology at the University of Mississippi Medical Center. We put together this video to help you better understand your child's diagnosis. As we've discussed, your child has a condition called posterior urethral valves. This occurs when a small amount of tissue blocks the natural drainage from your child's bladder through the penis to the outside world. Over time during development, this puts additional pressure on the kidneys and the bladder, which can lead to long-term changes which may not even be seen initially, but will develop as your child progresses in years. As discussed, the initial treatments for this generally include surgical options. We may have discussed with you something called a valve ablation. During this procedure, we go in through the natural opening in the child's penis with a camera, and we use a small scope to resect that small amount of tissue to allow the urine to drain more freely. Another possible surgical option, which we may have discussed, is called a vesicostomy. This is when we surgically create an opening in the bladder to allow the urine to drain through a small space in the abdomen to the outside world, again helping to decompress the bladder and the kidneys. We understand that this can be a challenging time for parents. It's an exciting time with a newborn, and being told that your child may need an emergency surgery that you may or may not have been aware that was a possibility can be a difficult thing for parents to process. We also understand that oftentimes parents aren't able to fully appreciate the long-term picture that's required for treatment of this condition after the initial surgical operation. It's well established that changes will occur in your child's bladder and kidney function over time. We expect to see differences in the way that your child's bladder and kidney may function up through infancy, during potty training, up into including adolescence. Many children with posterior urethral valves will go on to have long-term kidney damage, which may require dialysis or possibly a kidney transplant. That's why at the Department of Urology, we're committed to helping provide you with the best tools, team, and framework to maximize the best possible outcome for your child. We've put together this video to help provide you resources to learn more about the condition, to provide links to our social worker in our clinic to help you to overcome any barriers that you may be experiencing to follow up in long-term treatment for your child. We've also provided resources to national organizations which may be able to provide you additional resources if you qualify. We want you to understand that at the Department of Urology at the University of Mississippi Medical Center, we are committed to getting the best possible outcome for your child. Over the next months to years, we'll be developing a tailored treatment plan and monitoring with diagnostics to ensure that your child has the best chance of optimal kidney function. Please don't hesitate to reach out if you have any questions or concerns, and we look forward to treating your child.